Hello, my name is Dr. Ramirez. I'm the dermatologist with Advanced Dermatology and Cosmetic Surgery. We have recently been collaborating with Villages Health to provide their dermatology services, and they asked that I do this video today to discuss the importance of self-skin examination and full-body skin examinations with a professional. To start with self-examination, as we're all aware, it is important to carry out certain self-examinations. We all think of breast cancer for women, testicular cancer for men. But skin examination, self-examination, provides a unique opportunity. Unlike other examinations where you have to rely on the sense of feel, in self-examination for the skin, you may literally find what's important right here where you can see it. And that's very important. So to discuss self-examination, as we're all aware, it is always recommended to do self-exams for things such as breast cancer for women, testicular cancer for men, and for oral and for skin cancer for everyone. Skin cancer provides a unique opportunity in that, unlike other things where you have to rely on a sense of feel and you can't see what you're looking for, skin examination, you can literally possibly find the important thing right out there where you are able to see it. This is important because we all think of the common skin cancers that I'm sure all of us have friends or family, basal cell or a squamous cell carcinoma, which thankfully are generally very low risk, and the biggest concern is the sort of scar we may be left with. But we also have to think about other more important and more serious types of skin cancers, specifically malignant melanoma and even some other ones that can be more rare than that. With respect to malignant melanoma, we always have to remember specifically the A, B, C, D, E's of malignant melanoma. So first, A, for asymmetry. In other words, a lesion is not round, not oval, one side doesn't match the other, an irregular shape. B, for border irregularity. So instead of a nice smooth border, perhaps a jagged, irregular border, or perhaps a border that's ill-defined. C, for color variance. That's the one probably most of us will know. So instead of a nice even coloration or something perhaps two-tone, a lesion that has a lot of different colors sort of clashing and crashing into each other, sort of brown in one area, black in another, red in another, or perhaps a white area where the colors disappeared, irregular colors. D, for diameter, roughly the size of a pencil eraser head or 6 millimeters. And then E, for evolution. In some ways, to me, perhaps E is perhaps the most important. Evolution as in there's a lesion that you've known for a long time that suddenly, for whatever reason, seems to be catching your attention, some change that you're noticing. It used to be flat, now it's become raised. It used to have a certain shape and now it's added a new shape. It used to be a certain color and now it's starting to change colors. And then there's also E for evolution, as in something that you've never noticed before that suddenly has appeared that is catching your eye. I like to call it the ugly duckling sign. So the A, B, C, D, E's of melanoma are something that you need to consider when you're looking and doing your full body skin exam. Doing your own self-examination. Obviously we're not in a bathroom. Kristen here will kind of help us with the concept. So using a mirror at home, be sure to check your front, check your sides, make sure you look underneath your arms, checking your forearms, check between your fingers. When going below the waist, check down between your toes and your legs. If you don't have someone to help you look at your back, use a mirror to try to do as much as you're able to. What to expect for a full body examination. When you come in for a full body examination, some people find that it's a little bit intimidating, but it is important because after all, you're not able to see what's on the back of your scalp or between your shoulder blades. When you come in, at least with me, you're going to be examined from the scalp all the way down to between the toes. We have you undressed to your underwear and bra. You can leave your socks on. We don't want your feet to get cold. We'll take those off as we go. What we do is I will often use a light to help me with the examination. I will start from the scalp, looking at all the skin underneath the hair, all the way around, and checking every part. And then we will methodically work our way down. Close your eyes for just a little bit. Okay, you can open, look up at the ceiling, and checking all the skin. From the head down to between the toes, examining the whole body, looking between the fingers, all the way down to the toes. This is important because, after all, I don't expect you to be able to know the difference between a freckle versus a sunspot versus an age spot. That's what the professionals are for. But again, that's what brings up the importance of your self-examination. Perhaps you've seen something that you can point out to us before we even get started, and then of course we can help delineate what's to worry about and what not to worry about, and perhaps find things that you can't see that you're not able to examine for yourself. So again, I'd like to stress the importance of self-examination. As I mentioned before, skin provides a unique opportunity to be able to find what's important right out there where you can see it. Also, the importance of a full head-to-toe examination on the part of a trained professional. You are your best advocate. Hopefully you can spot something important before anyone else knows to warn you to do so. And then when you come in with us, perhaps we can help to delineate what's to worry about and what's important, and also to see spots that frankly you're not able to. This is especially important these days with the pandemic. In 2020, there were over 1 million cases of skin cancers that went undiagnosed. Now that life is starting to go back to normal, please come in and let someone check you and be your own best advocate. Spot the spot early while you can. Thank you.